All right. Hello, hello, hello. We thank you all for being here. We are here with Mr. Joel Johnson, President and CEO of Treatment Alternatives for Safe Communities. I always like to start with a brief intro, even I try to be brief. Joel's wonderful career and expertise and experience spans many pages, but I'm gonna give you just a little bit. So as TASC President and CEO, Joel is an advocate for individuals and communities that are dealing with trauma, substance use disorders, mental health challenges, family disconnection, and social and racial and economic injustice. From the front lines of clinical care to the nonprofit executive leadership, he's maintained a steady focus on ensuring health, dignity, and opportunity for all. One of the most important for me, Joel is a graduate of Florida A&M University, a Bachelor of Science in Business Administration, Master of Education in Counseling, a life member of Alpha Phi Alpha, serves on several local, regional, and national committees, is a native of Chicago, which I'm sure that he and Tacuma will chop it up shortly, and has earned Chicago Defenders Men of Excellence Award in 2014. So before we jump into Joel, great to have Tacuma back helping me navigate these discussions. And with that, want to welcome Joel Johnson. Welcome, brother.
Thank you much. Thank you for having me. Appreciate this platform.
Man, we thank you for being here. As you all might know, Black Men's Health is really about focus on creating balance through health for men of color. While we focus on many things, we are doing it under the pillars of mental health, physical health, spiritual, financial, social, and what did I miss, Tacuma? Mental, physical, spiritual, financial, and social. And today we're talking a lot about mental health, and obviously we're talking about substance abuse and some other things, but Black male mental health matters. So with that, again, welcome, Joel. Tacuma, let's jump on in, brother.
Oh, absolutely, absolutely. We welcome Joel to this platform to talk about a really critical issue that is impacting our community at a seismic level. And I think when Joel and I discussed earlier, it's something that we see play out in our headlines, every night almost. And, we talked about Joel being from Chicago, and, I'm not from Chicago originally, but I've been here for a long time. And I know that when you say the words Whitney Young, it just means a whole lot. And so to kick off the question and answer session that we have here, Joel, when I mention the phrase where academic excellence is the standard, what does that mean to you?
Yeah, I mean, Whitney Young is a huge part of my development as a human being, as a Black man. And I think having had the opportunity to attend Whitney Young in the 80s was a powerful time. I mean, a lot of our classmates went on to become everything, right? The Warshawski brothers and the creators of video games and film creators and politicians, et cetera, professional athletes. We just had a lot of creative genius at one central location. It's really Chicago's first magnet high school that brought together people from all classes, races, and ethnicities into one special place that has continued to grow and be a symbol of excellence in Chicago.
Absolutely, absolutely. My wife went to Lindblom, proud graduate. A couple of weeks ago, we had a reunion. I once said the Lindblom colors were like maroon and yellow. She was like, "No, baby, it's maroon and gold." So
she said,
"Get it right."
She said, "Get it right."
Get it right. I was like,
"Right,
get
it right." I have two sons at Lindblom, so much respect.
Absolutely, absolutely. With that said, can you talk a little bit about growing up in Chicago and what that was like for you?
Absolutely. You know, I grew up in a middle class community in South Shore. My parents were married, divorced, and remarried. So, but I always had two parents in my household at all times, two younger brothers. Church was a big part of our foundation growing up. Sports. My brother, my middle brother, and I were competitive swimmers. No, it sounds very country clubbish, but it really wasn't. And if you saw that movie Pride, then you know that was a lot of what we dealt with, a lot of racism in the space of swimming, where we were often not the common look, you know, the African-American kids showing up to suburban and even urban communities that were mostly white. So that also had a lot to do with my upbringing and character building. I actually met my wife in the swimming pool. She was a competitive swimmer as well. And Whitney Young, during my tenure at Whitney Young, we were city champions all 4 years on a team that was largely African-American and Latino. Very few white swimmers in that space, even at a magnet high school. So that should help you understand even the level of talent that we were recruiting from academia across the city to come to that space, and the top swimmers were African-American. But growing up in Chicago was a special place in the 80s, with people like Harold Washington coming into office as the first African-American mayor, leaders like John Stroger rising to run Cook County government. It definitely was a learning point for not only me as a young man in the city, but for African-American men across the country to go and look at the history of Chicago during that time in the 80s. It was an interesting place to be.
Mm-hmm. Absolutely, absolutely. My question to you then is, like, even as a kid, did you begin to see yourself in terms of what you'd be doing in the future? How did that come about for you?
Yeah, no, I wanted to go and make money and, you know, be powerful and spend frivolously. And, you know, I was even recruited down to FAMU partially by watching Miami Vice. I didn't know Tallahassee was landlocked and had red dirt and those types of things till I got there. But really, you know, watching Miami Vice, like, I'm gonna go to Florida. But seriously, I never thought. My mother is a high school counselor and educator, and she was the servant leader in our household. My father worked for the electric company. My mother worked in the school system. She often brought kids home who did not necessarily have the things that we had, or to expose them to different things on weekends. She'd bring some of her students home, or I would go to school with her. And so I saw her giving and pouring into other children who were not her own. I went to FAMU to study business. And again, I wanted to make my mark in society some way, making some money. But through internships, I really decided I didn't like corporate America. And the for-profit world wasn't for me. And I didn't know what I wanted to do. But I went back to FAMU for graduate school in counseling, because I felt that I wanted to give back. And there was a pivotal moment that helped me make that decision that I wanted to give back. And the rest is history. I ended up working in child welfare and behavioral health and healthcare. But you know, I never thought in a million years this is where I'd be.
Mm-hmm. Absolutely.
Joe, previously, before this role, which we want to get into, you know, we know you served as executive vice president of Friend Health, as well as president of Human Resources Development Institute. Would you talk a little bit about that, you know, that experience, knowing that, you know, we know it's a large Chicago-based behavioral health service provider, and yeah, tell us a little bit more about your experience at HRDI and the work that you all were doing there.
Absolutely. So let me say that I came to this space through child welfare. I ended up leaving graduate school and working in the child welfare space. And I was always kind of motivated by helping people that look like me young men in particular that could have been me navigate some of these deep end systems. And so working in child welfare, as we try to keep families together or reunify families and strengthen dynamics to help families survive, one of the trends that I saw was that many of these families that were impacted by this intrusion of the court system in their lives was really not because of egregious abuse, but mostly because of neglect that came as a result of mental health and substance use disorders that were untreated or negatively impacting the family at that point in time. And that if we could help people access treatment, we could stabilize these families and keep these families together. And so it was that, and my own family impacted by substance use. You know, I have a brother that has lived experience with substance use disorder. And so in my quest to help and heal the broader community, I had this desire to help and heal my own family. And so that's what brought me to HRDI from the child welfare system. I was working at an organization called SOS Children's Villages. But again, 90% of the families we worked with, it was a mental health disorder or a substance use disorder that caused that family to come to the attention of family court. And so I pivoted to say I could help the child welfare system by better helping the behavioral health system. And so that's what drew me to this work at HRDI. And I originally went to HRDI as a chief administrative officer and worked in that capacity for a couple of years before becoming the CEO. And in that space, we provided, a full continuum of care of residential, community-based, outpatient, crisis-centered mental health and substance use disorder treatment. And as we treated people, I also recognized that as much as I poured into people or the staff poured into people and helped them empower themselves to improve their condition in life, behavioral health was only a part of the full health spectrum. And so if they came to me for treatment groups or outpatient treatment, they still weren't going to the doctor to get their blood pressure taken care of or to address COPD or even some of the health concerns that were resulting from their substance use or a mental health disorder. And so I sought to build a primary care component to the work that we did, which resulted in a merger with Friend Family Health Center. And that surviving entity was called Friend Health, where HRDI was a behavioral health subsidiary. And we were able to positively impact the community by bringing primary care and behavioral health together under one roof instead of people being served in silos where they had to go get their mental health over here and their behavioral health over here and their dental over there. Now we created a platform where people could go get it all under one roof, which also helped reduce stigma. You go into this clinic and you're not necessarily going for mental health services, you're going to get, your teeth cleaned. While you're there, you happen to go ahead and get that appointment with your therapist and also see your primary care physician. So one of the biggest barriers to people accessing treatment is stigma. And so by integrating these services, we're able to help reduce that stigma.
That's awesome. I know universities are going to that model. Our own university has a new building. And to your point, Joel, it's built with that in mind, all these services under one roof. So you're right, if you're going to student health for whatever reasons, you're not going into a building where everybody sees you're going. You could be going into that building for a number of things, but you can also get many services. And to your point, not have the stigma of you're going here, or you're going there. You could be, accessing many services. You have many reasons for being there. So that's gold. Tell us a little bit about TASC and the work that you all are doing there.
Okay, I will do that. But before I do that, let me tell you what brought me drew me away from business and to this health and human services field, which ties in directly to TASC, right?
Please,
So
please.
John, you may remember this because we we were doing this together back in the early 90s. Our fraternity, Alpha Phi fraternity, our chapter, we would go to the Juvenile Detention Center in Leon County, Florida on Saturdays and spend time with young men, trying to help them choose a better path, to choose education, choose high school and college. And you may not remember this, John, but when we would go on Saturdays, there was always a young man there. I'm sorry, this was 93. So it's your brother, Junius, that was with us. There was always a young man that was there every weekend. And I was like, why are you always here? How is this possible? Because the detention center was for processing, and then you'd be released. And even if you were adjudicated and went to some juvenile correctional program, you wouldn't always be in the detention center. This young man was always in the detention center, which meant that this young man was reoccurring arrests. And in September of 1993, after I graduated and had returned to Chicago, you may recall, John, that in Monticello, Florida, 2 British tourists were carjacked. And so there was this trend in Miami where tourists were being carjacked. And that's when rental car companies stopped putting the sticker in the window that showed you it was a rental, right? And I always say, whatever's happening in the big city, you know, our cousins from smaller communities want to compete with us. And so they were doing that in Miami. So these young men from North Florida decided they want to do the same thing. And they attempted to carjack this British couple at a rest stop. And a gentleman by the name of Gary Coley was murdered as a part of that failed carjacking. There were 4 additional lives impacted in addition to those tourists. And they were the 4 young men that were arrested. They were teenagers. One of them was charged with the murder, and the other were also charged with the accompanying crimes. But these men, one of these 4 young men was this same young man that was always in Leon County Detention Center. And we couldn't reach him. No matter what we tried to do, we just couldn't reach him. And that's what called me back to FAMU, to graduate school, in counseling, to try and figure out, how do I reach this population? And I thought maybe it was going to be to go into the school system and be a counselor or educator, but it took me to this Health and Human Services path. Now, fast forward to TASC. Treatment Alternatives for Safe Communities is a 45-year-old nonprofit here in Illinois. It's part of a larger TASC movement nationally, but we are embedded in the criminal justice system by statute, which says that if a person in Illinois is arrested, they have a right to be screened and assessed for substance use disorder, which may help reduce, or in some cases, eliminate sanctions for their criminal offense. And so TASC, my staff, operate in all 102 counties in Illinois, in courthouses, in correctional facilities, in prisons, and in the community, providing that screening, assessment, and case management, where we refer people to treatment providers similar to HRDI, hoping that helping them get treatment they need to help them reduce their sanctions and navigate the criminal justice system. So ironically, the thing that brought me to this work is what I'm leading now as the president and CEO of TASC.
Got it. Thank you, brother. I see Tacuma had to step away for a minute. Oh, there he is. Want to jump back on in, Tacuma? You good?
Absolutely. I wanted to piggyback off that as well, because we often hear the word crisis when we talk about kind of the state of mental health with men of color. But I really wanted to ask you the question, is that apropos, and what is the current state of Black male mental health from your perspective?
Yeah, well, I think any crisis in our community, or the state of our community, or of our country, our nation, oftentimes have implications on the mental health status of the African-American community, in particular men, right? And so James Baldwin famously said that, to be a Negro in this country and to be relatively conscious, right, is to be in a state of rage almost all the time. And so if you take into account everything that's happening between racial injustice and the state of politics and this kind of microaggressions, macroaggressions in this country, African American men are having a tough time, I would say. And as an African American man, I know that I often feel the weight of the world on my shoulders, being a provider, being a father, being a husband, being a part of a community. And then, oh, by the way, everything happening in Chicago, the father of sons. And so with the violence and all the things, both real and perceived, happening in my community, it's no wonder that more of us are not exhibiting mental health crises. And the reality is a lot of us are having issues, but stigma doesn't allow us to ask for help or even to say that we need help or to acknowledge the pain that we're in from time to time. And so this is platforms like this is why I was happy to participate, really help us normalize. And there's a brother here doing this remarkable thing here in Chicago. Christopher Lamarck has a social enterprise called Coffee, Hip Hop, and Mental Health, where he himself came to terms with his mental health needs while in a coffee shop. He opened a coffee shop to fund a movement that's called Normalized Therapy, where he's helping to provide therapy for people in need and funding that therapy through the coffee shop. And it's a powerful platform that outside of the normal, therapeutic relationship that I have become accustomed to, because he's not a trained therapist. He's a guy who was with lived experience, who saw an unmet need and figured it out. And so, I mean, things like that create those opportunities in our community are things that are going to help us turn this corner and really kind of embrace help that is out there, help that's out there, create more access for help like that in the future.
Absolutely, absolutely. And I apologize for the lighting situation. I'm going to get that fixed here in a moment. But
you look wonderful. You look wonderful, brother, as usual.
I think you can just see my teeth at this point. I did have a question about emerging trends that you've witnessed in your line of work with regard to our mental health, with regard to substance abuse. Can you talk about some of the newfangled trends you're witnessing when it comes to Black males ages 1 to 19, Black males ages 20 to 44, and so on?
Well, I think, yeah, so there are always trends. I think what's consistent is that substance use disorder and mental health disorders are chronic illnesses. And what the trend I'd like to start is us helping people with chronic illnesses. We don't treat people with heart conditions or with cancer the way we treat people with mental health disorders and substance use disorders. And so we really got to eradicate stigma. So the trend I'd like to see is eliminating stigma and people who need help feeling comfortable acknowledging that they need help and receiving the help that they need. I'd like to see a trend where our country, our nation invests in treatment services and prevention services, treatment services, recovery services, and funds it at a level that makes it more accessible, that the quality is not compromised because organizations are trying to cut corners. And we treat these professionals, these therapists and counselors, like true professionals and providing them with wages that really exemplify how we feel and value them in our society. There's always a new adulterant being added to drugs, fentanyl, and we saw with the passing of Michael K. White, fentanyl introduced into cocaine. A lot of times we think about fentanyl and heroin. That same weekend that Michael K. Williams, I should say, the same weekend that he unfortunately passed, there was a comedian in LA and a few other people who also had done cocaine. So on different coasts, there was cocaine.
You told me about that, Tacuma. You told me about
fentanyl.
that.
So yeah. we see there are always trends about new drugs or adulterants added to drugs. And we're adapting to those and trying to prepare our community. I'm actually having a briefing this week for my staff, trying to understand what the adulterants are in Illinois that are in the market based on data that's been gathered by law enforcement to understand what's hitting the streets so we can better prepare people. But I really would like to talk about the trends that we want to see. We want to see people seeking help and getting the help that they need in a timely manner, that there aren't long waiting lists. We want to see more people choosing these professions, social work, counseling, drug treatment professions that people are paid a living wage, an honorable wage, that the rates that Medicaid and insurance companies offer for these services are on parity with primary health rates for similar treatment of other chronic illnesses, so that we can really build a workforce that can respond to the needs of our communities, regardless of color, regardless of socioeconomic status. Unfortunately, the work that we do, that we're talking about tonight, that's so important, is underfunded. And what that means is that there are a lot of open positions. We can't keep those positions filled, which means there are waiting lists and people can't get the help that they need and deserve in a timely manner.
So what does it take to get there, Joel? What is it? How do we elevate it? How do we make it a priority? What needs to be done that would put those things, create that parity related to, as you said, things that might be, other medical issues that are funded at a high level?
Yeah, so the irony is that parity laws already exist and we're still not funding equitably, right? So we need to continue to have conversations like this, and we need to turn that conversation into advocacy at the city, county level, at the state level, and at the federal level, because everybody's got a stake in the game. We know that there's a lot of federal dollars out there as a result of COVID, these ARPA funds, but that's time limited money. That there's a fiscal cliff coming with that. We need to change the funding formula for this. In that regard, that is going to take engagement of our elected officials and helping them understand why this is important. And so there are impact statements, right? How is this affecting our community? It's going to take more of us to be more vulnerable about what we need and what's happening in our homes, so that people understand and see how normal the need for this type of support is, so that we can normalize the actual intervention and the funding of that intervention. So more dialogue and more advocacy.
Joe, you referenced earlier when you were talking about the brother with the coffee shop, and using that enterprise, that social enterprise to fund mental health services, and saying he's not a trained mental health professional, which I think is amazing, right? Because somebody doesn't always have to have the credentials and the degrees to do the amazing work. We've done some work locally. I was blessed to do some work locally, doing some Black men's mental health training and working with barbers and coaches and mentors and trainers and things of that nature, to even served as a liaison, right? Be able to pick up on these just identifiers of something that might, where people might be having challenges. And especially with the barber, they might see you more consistently, maybe every 2 weeks or every 3 weeks, maybe every week, depending on how much you get your haircut. But they could see changes, and at least they could stand in the gap and be able to identify things and then get you to a mental health professional. How important is that, Joel, right? Having brothers like him, that he could still do the work. He doesn't have to, be educated at the highest level to be able to help somebody identify that they might need some assistance, or him even be able to provide assistance to point them in the right direction.
Yeah, no, it's not even about education, John. The reality is that persons with lived experience are invaluable. They have walked these paths, maybe not identically, and so they understand how to engage people in a way. Sometimes we're just too smart. We got book smarts. We just dumb on some of the engagement stuff that we really need. And not to disparage anyone working in the field, but persons with lived experience have the ability to help engage and make that bridge between that person in crisis or that person's immediate need and in getting them into the treatment, there's a process there sometimes that, you know, you show up at my office and I go, all right, you're here for help. I'm here to help you. But there's sometimes there's a conversation, or sometimes there's just a connection that needs to take place to help you be ready to have that conversation. You showed up, but that person with lived experience maybe understands what you're thinking. It may not be you need the therapy, but maybe you need a sandwich first, or a bottle of water, or just to sit down,
I was gonna say a listening ear, huh?
or a nap, right? Maybe you're just tired, and when you wake up, you're ready. And so sometimes that person with lived experience. So I think what he's doing from the space that he's doing is remarkable, because we're hiring people with lived experience for that very reason, to help us understand, you know, the emotional intelligence of this work in a way that sometimes we're so caught in the therapeutic model, and, you know, or billing, or, you know, all jobs become repetitive at some point in time, and we need somebody to hold us accountable, and having people with lived experience help us navigate the world that we work in is definitely invaluable. And so what Brother Lamarck has done, I think, is just an example of how, and nationally, people are using cafes and barbershops, like you said, to as a place to help people feel comfortable enough to get the help.
I was about to say, when you said comfortable, I was about to speak about that relevancy, that accessibility, right? That approachability, that's definitely invaluable.
Mm-hmm. And again, you know, he's creating a space that's not intimidating. Unfortunately, you know, we know that that's a mental health clinic on the corner, and so that's intimidating in and of itself sometimes. And so maybe engaging at the Starbucks or the McDonald's as a first couple of points of connection is a way to get you into the door at the mental health center. If we only serving people at the mental health center, or only providing care from that mental health center, and that's it, then, you know, that's 50% of the barriers. We have a wall and a door in between us.
Indeed. Go ahead, Tacuma, brother.
Yeah, and this is a really interesting point about that you made about, you know, opening up in non-traditional spaces and having those spaces for us where brothers feel comfortable to really talk about what's impacting them. And what I wanted to ask you, it's kind of a roundabout question, but I'll start off with an example. Let's just say that there's a breakup in a relationship. We often see that women, and this is a mass generalization, there are instances where this isn't true, but they tend to have more of a community that they can go to for that nurturing, that support, and things like that. Whereas sometimes with us, we don't have those kinds of outlets to express what we're feeling, to talk about those issues with mental health. And so looking at that hypothetical, how would you, as somebody who's worked in this field for such a long time, how would you fix that disparity by just addressing that disparity in like mental health services and support that's not available typically for us?
Yeah, so that is a generalization. Don't get me in trouble with my wife and my mother and other women in my life.
Joel said he didn't say it. Joel said he didn't say it. Tacuma said that.
But I think, you know, what we're talking about is being vulnerable and feeling like you have a safe space to be vulnerable, right? And so, first of all, I think every man should have a friend that they can open up to, if not a circle of friends that they can open up to. And that's a level of social emotional wellness that we got to get to. Again, stigma is the biggest thing we're fighting. If no one takes anything away from our discussion tonight, stigma is the biggest barrier people getting the help that they need. It's not finances, that's second. And with
yeah,
the
I was about to say, you said it was over cost. You said stigma over cost.
Yeah, with the expansion of the Affordable Care Act, cost shouldn't really be a factor as much today as it was before that, but stigma. People do not want to be perceived as that guy, right? Or that person, or having within our own family structures, our friend circles, et cetera, et cetera. And honestly, that's the place where we should feel the safest. So, I talked about, these initiatives where people are trying to create space. Same thing is happening and has been happening and should continue to happen in churches and faith communities where ministries for treatment, for therapeutic interventions exist, where people can come, be vulnerable in their place of worship and be extended or referred to resources perhaps outside of the church if those resources are not available, or to the extent that they need to be available within the church. But we've got to figure out how men can talk to men, and there's always an initiative about men, and we just got to continue to have these discussions. I think the other thing is, everybody should have a mentor of some sort, whether it's a formal, structured, preferably a formal, structured relationship with somebody to help you get better at something in your life. And I think that's a safe space for men to perhaps have that conversation as well about what's weighing them down. It may not form a therapeutic relationship, but that doesn't mean that it can't have therapeutic outcomes. And so my ability to just talk about how hard work is, to somebody consistently, to get feedback, a sounding board, or even advice on, did you think about doing it this way or that way, but just getting it off my chest has got to help, right? And ultimately, if we need to have a counselor, a therapist to bounce, there was this in the early 2000s, there was this wave of life coaches, right? And it was pretty much unregulated. Now there's certification for life coaches, but a lot of the initial wave of life coaches were social workers, people with social work backgrounds, because it's akin to therapy. And so again, a way to get around the stigma, I don't need a therapist, but I do need a life coach. And then they show up every week for the life coach and get therapy. So I don't care what you call it. You can call it basketball coach if that makes you feel better about it, if you do the work and talk through the issue or issues that are weighing you down so that it doesn't manifest negatively in the rest of your life.
I see a question here, Joel. I would like to know if you think the systems in place have helped to create and permeate the issues that negatively affect, particularly the African American population, and if so, how do we affect that?
Yeah, so systems, right? So yes, the short answer is yes. Systems that are in place have negatively impacted, and systems need to change. In some ways, we need to just blow up the systems and start from scratch. In some ways, the systems are so complicated, and we're a part of these systems that we need to, strategically alter those systems to make sure that we don't do more harm in the process of doing good. But the mental health system and the substance use treatment systems are siloed. Substance use disorder is a mental health disorder, but they're siloed. They have different funding and different rules. And in Illinois, they're under the same umbrella agency of Department of Human Services, but they have different rules, and they don't communicate with each other. And so if I have someone that comes to TASC or one of the other treatment providers that has both a mental health diagnosis and a substance use diagnosis, I have different rules and different people in some cases to help provide them with the level of support that they need. And so we're creating barriers for the very help that we say we want to do. So our ability to get the work done and not jump through all the regulatory hoops is usually where we have the most innovation and success. But, that's not unrealistic in a world that revolves around regulations in order to justify payment, et cetera, et cetera. So, you know, it's no margin, no mission. I can have the best intentions, but unless I can pay people to do the work, then they're not going to show up to do the work. So you know, we're very mission driven. You know, at TASC, our goal is to create a healthier, safer, more just society. But I have to, you know, navigate the compensation world to make that happen. And you know, these regulations and the systems that are in place, and then there's the court system, and there's the justice system, and then there's the education system. And I already talked about the court system, which relates to DCFS and child welfare. So we help people navigate these systems. That's what TASC does through case management. But these systems are there and need someone to help navigate them, unfortunately.
No margin, no mission.
No margin, no mission.
I just had that discussion today with somebody talking about mission. I was like, you got to figure out a way to fund that mission.
That's right.
That mission not moving on its own.
That's right.
Joel, you referenced, you know, again, just stigma. We could discuss that for you know, a whole hour. But you reference, you know, men having the ability to talk to friends, close friends, circles, etc. I mean, that's part of the challenge in itself, right? People that you don't care about, you could care less what they think, right? People that you care about, sometimes it's harder to have that discussion, right? I mean, even if you're talking about relationships in the sense of marital relations, right? Husband-wife type thing, or boyfriend-girlfriend, or whatever it is, your boys, your girls, whatever it is, the closer you are to somebody, the more vulnerable you are to somebody, which also means that something small can slice you in half, right? You know, somebody passing you that you could really care less about, and I'm not saying that negative, I'm just saying, you know, you ain't thinking about them. If they say something, it just rolls off your shoulder. But somebody that you're super close to and they have a little slight comment, or sometimes breathe the wrong way or comment on something, it can, you know, again, it could literally slice you in half emotionally. So, you know, how do we get around that in the sense of having close relationships, but being able to get over that concern, that stigma, just get over the concern of what we might be, or how really concerned what somebody else might feel, to really be able to address something that we have going on, and not be tripping on our heads about how somebody might feel about that.
Yeah, no, it's got to be a safe space, right? And so we all have friends, and we also know who our friends are, right? And so they have some friends that I know I can talk about cigars and bourbon with, and that's it. Like the conversation is not worth anything after that. There are other friends that I know that I can talk about family and being married, and there are other friends I know I could never have that conversation with. And so knowing who your friends are, right, I think is you got to be honest with yourself, and you got to be a friend to have a friend. And so, you know, if you need that person to talk to, you got to be a person that people are comfortable talking to, right? They got to know that you keep things in confidence, that you aren't judging, et cetera, et cetera. And I think that's not a lot to ask of a friend, but sometimes you may not have that around you, and I get that too, right? I mean, you know, we're the sum total of our experiences, and so it may be talking to a minister, you know, not even from a Catholic perspective of you talking in confidence, well, anonymously, but talking in confidence to your pastor or a person of faith. You know, back in, I think it was the 80s or 90s in New York City, there was this movement to train bartenders in basic counseling principles, because people would go to bars and just kind of unload to the bartender, right? Kind of cliche, but it happened. And so I don't know what the results of that was. You know, we felt like people were then further, you know, encouraged to seek more professional treatment, but it was a way of getting people some immediate help where they were, where they felt comfortable, right? In order to help people, if somebody's you got to bend down to pick them up where they are. You got to meet people where they are. And so, you know, taxi drivers, bartenders, you know, wherever people are, barbers, et cetera. That's why these trends of health initiatives in these spaces where they come from, because that's where people go. And so I think our coaches on organized sports and things like that, they also should be trained in some basic engagement to try and understand how to identify people in need of help. So there's this movement about mental health first aid. It's a whole training that's going on nationally where laymen have the opportunity to be trained in mental health first aid, so they understand when they're seeing a crisis, they know what that crisis is and can help people navigate that crisis. And so more of that needs to be more common so that people who may be in crisis get the help, but also just as you engage people on a daily basis, you kind of can lend that active listening and engagement to someone. They just sometimes just need to be heard, and being heard is enough. And not being heard manifests in a crisis where people blow up. And so, we want to make sure that people are heard and that they have a right to be acknowledged. And in doing so, we've helped avert a crisis.
Speaking of that and being heard, we know that representation is a part of that equation. Being able to see someone with your background who looks like you in the realm of mental health to help knock down the stigma that you mentioned. So I wanted to ask you is, someone who has been very successful in this nonprofit spectrum dealing with mental health services and what have you, what keys of advice would you have for someone who may see, maybe mission driven and may see, may have a heart for the kind of work that you're doing?
Well, first of all, success is relative. I appreciate you saying that, but we're mission driven because I'm mission driven, and there's a lot of work to be done. And some days it feels like we aren't making a dent in it at all, right? But we look at benchmarks and we measure and we understand the impact that we're having. I think that this is not it's not about being a CEO. It's about being a servant leader. So for me, it's about ensuring that we make an impact in our community, not about the title. Our team at TASC and the other organizations where I've worked is never about somebody being a boss. It's about being a team member, and their coworkers. That we all have different roles in the work. The ultimate mission, though, is what we're trying to execute on. And so we all have to play our role. I think that when you commit to something, you commit to it and you see that mission through. And so those people who want to join us in this fight, there's room. There's hundreds of open positions. I met with another leader of an organization today, and they have, X many open positions. We have 70 open positions today. And the same is true across Illinois and across the country. We have more positions than people. So we definitely want to get people in this pipeline. So people thinking about a second career, there may be opportunity for you. But don't come to this work if the mission is not what's drawing you to the work. We have compensation challenges? Yeah, we're working on that nationally, right? But the people who stay, who do the heavy lifting, they do it by and large because they're drawn to do it. It's something in them that says, I want to help. Sometimes they have lived experience, or someone in their family has lived experience like I do. My father was in recovery for a number of years before he passed. So I get it, right? And I want to leave my community better than I found it. And there's a lot, and I live in the community. Like, I'm not hiding from what's challenging our community. And so, I'm engaging people on my way in the grocery store or getting gas, et cetera, trying to figure out I came to this business trying to figure out how to help my brother. So this is more about living the mission than it is about anything else, any success, any accolade. Now, the good news is as an African-American leader, there are not a lot of us. That's not the good news. But because there are not a lot of us, and people want to hear what I have to say. So I revel at any opportunity to be the African-American person at the table, but there need to be more of us at the table. And I don't speak for all African-Americans. I don't presume to do that, but I want to represent African-Americans well, minorities well, and I want to make sure that at least my voice and my perspective from the African-American experience, which is a wide and vast experience, but I want to make sure that if the invitation is there, and if the invitation is not there, I'm probably going to try and make one myself and invite myself to the table, so that we understand how we can impact and better serve the communities where we live in a responsible, quality way that takes into account the African-American experience, cultural experience needed, I think, to effectively serve our community.
Joel, you spoke about earlier, you want to be the friend that you hope you have, right? You also just spoke about, doing the work, whether it's at the grocery store, the gas station, et cetera. Earlier, you talked about, just the weight of your world, the weight of the world on your shoulders as a Black man. And all three of us on the call here and many people in the chat understand that, just navigating in this world. So, what advice would you have for men, trying to make sure that we are warm to an opportunity to be able to help, especially if you see concern or if you have concern for what you're seeing or hearing, at the same time, while you are just trying to stay balanced yourself, right? Trying not to snap, trying not to, get off balance, trying to stay balanced in all the balls in the air, and emotionally, physically, spiritually, on and on and on. What advice would you have in the sense of, we want to definitely be there for somebody we see in need. We ourselves could be in need and we want that person to be there, but also we're trying to deal with so much. What advice would you have for the brothers?
Yeah, so find a hobby, right? It seems oversimplistic, but too many times our hobbies are habits, right? So whether it's drinking or smoking, those are hobbies, those are habits that we do instead of a hobby. But join the gym, work out, run, boating, something that's going to get your endorphins moving. And I'm the fat guy at the table, right? I need to work out more, but I need to figure out, making sure that my hobby is not a bourbon a night, right? Or a cigar a day, right? The things that are going to probably provide you a little peace with your mental health, but cause you to impact your primary health negatively, right? And so find a hobby. Before we went live, I apologize to you both in advance in case you heard the dogs in the background, but get a pet, do something other than sit there and complain about everything that's not going right in your life, right? And that's an oversimplification, but that's a challenge, right? To acknowledge that you're not feeling good about everything that's going on, and then to seek, focus your energy on something else that makes you feel good, and seek a solution to those things that you think are not going well, right? And so, to the extent that there is a solution, find that friend, right? I mean, develop healthy relationships that don't always take you down the rabbit hole of negativity, and seek support where it exists naturally in our community. So, like I said, you go to the doctor's office, and now 9 times out of 10, when you go to your primary care physician, the nurse or the medical assistant who's rooming you is asking you a couple of questions. Be honest. Those questions are usually something like, have you, felt like you wanted to hurt yourself in the last so many days? Have you had more than 4 drinks in a setting in the last? These are questionnaires, the PHQ-9, the GAD-7, they're scales that help us understand how you're living. If you answer them honestly, it'll give us some clues into whether or not you need an intervention at that point in time. Be honest, or just ask for the help. Yeah, I do want to talk to a social worker before I leave today. if you don't want to talk to somebody you know and you don't feel comfortable talking to a stranger, eventually you'll become comfortable. But I think, you know, it all goes back to stigma and our comfortableness being vulnerable enough to say, I need help, or even not even knowing that you need help, but just, I don't feel good. And kind of articulating what that feeling is so that someone else can help you identify what that feeling is so that you can get the help that you need.
Tacuma, I know you had 50 questions, brother. Ask away before we start to wrap it up and let Joel get back to the family and both of those dogs.
I see that we have a couple questions in the chat. You know, maybe get to maybe one or two of them. We don't want to keep you, of course, and we thank you for your time in doing this. But is there anything else that you'd like to offer or say?
Well, I would say that, you know, thank you. I think that's my mother in the chat there. And Reverend Tommy Johnson is a former employee at TASC and a soldier out here in this recovery world. We just did a recovery walk together along with Congressman Danny Davis and a lot of other community supporters
Awesome.
to bring awareness to recovery. National Mental Health Awareness Day was just the other day, and Recovery Month was last month. And so every day is a recovery day. Every day is an opportunity to get help. And if I can be a resource to anybody, you know, I want to offer that to whoever's watching today. But I think there's some opportunities for people who are looking for some place to be vulnerable. You know, there's a National Association of Black Social Workers. There's a National Association of Black Psychologists that have chapters around most urban centers or in states. And so going to their websites, I think you can find a resource near you. National Alliance of Mental Illness, NAMI, not a quote unquote Black organization, but an organization with a huge footprint, again, nationally. And so they have resources. If you go to their website, you can find your local a list of providers where they can help you find providers in your community. And I think it's important to understand that help is just that, it's help, right? And we should all be empowered to help ourselves and help people around us. And if we are living with the substance use disorder, or if we, you know, overindulge sometimes, or if we have a mental health concern, depression, anxiety, it's okay. There are a lot of famous and not so famous people who are powerful and all those things who are living with some of the same challenges. And that's actually a part of their superpower, right? And so embrace the fact that you acknowledge that this may be something that you need to address. That's your body telling you to check it out, right? And then call one of those people that these organizations that I highlighted to get that support. You know, the Chicago, this brother, Dr. Obari Cartman here in Chicago, and the Black psychologists doing powerful work in the community. Again, the brother Christopher Lamarck, and this coffee hip hop. I mean, I had on a sweatshirt the other day on the plane, and people were asking me about the sweatshirt. That's a huge platform to have that merchandise out there that makes it cool to seek help. And so we need to create more of Christopher Lamarck's and opportunities like that across the country, where people can access that help through, you know, going to get a cup of coffee, it generating a conversation, and you landing, you know, someplace. Their phrase and their movement, again, is normalized therapy. And isn't that a novel thought, where we can feel comfortable enough telling people that I need help, or asking somebody to help you get help. And I had a close friend call me not too long ago and just said, hey, I drink too much and I need some help, and I'm going into a detox unit today, and I wanted to tell you. He thought enough of me and what I do to share that with me. But now it's my responsibility. I've been trying to encourage him along the way. And he just celebrated 2 weeks sober, right? Which is huge. And we had to celebrate that together. And we can continue, be the help that you would seek from somebody else. And we'll be a better society, a better people as a result.
Amen. Black Male Mental Health Matters. Here with Joel Johnson, President and CEO of TASC. Joel, we appreciate all the wonderful work that you're doing in the community for others, and especially for brothers, but everybody, and the work you continue to do. Shout out to Mama Johnson in the chat. And we just appreciate your time and attention today and sharing with us. Tacuma would definitely have more so we can continue to spread the good word. And anytime that we can be a help at Black Men's Health to elevate and make more people aware, please let us know, brother.
Absolutely. And again, thank you for this platform. We need to have more conversations like this for our community, but for the human community, right? The larger community. And so again, thanks for taking this initiative to have this conversations like this, because it's needed.
And we welcome you back. We trust me. If we say we're gonna have you back, we're gonna call on you again. So
all right, let's do it.
Please stand ready. We appreciate you, Joel. Tacuma,
Yeah, thank you.
Always a pleasure, brother.
Much.
Always
Same.
a pleasure. All right. Thank you all. Respect.
Thank you.